While South Africa's COVID-19 cases have now surged past those of the UK, Spain and Italy, which were the hardest hit in the early stages of the global outbreak, the country's death rate is still much lower than those countries. South Africa is not alone in fighting the global health crisis. The United Kingdom stepping in to support our response and our recovery. Funds have been committed to support small businesses, manufacturing PPE, grants to organisations supporting women's rights, as well as supporting remote teaching and learning through the British Council and the Department of Basic Education. But let's get some more on the supportive efforts now. We're joined by Nigel Casey. He is the British High Commissioner to South Africa. He joins us via our Skype line in Pretoria. Nigel, good morning. Thanks so much for your time on the AM report. Perhaps let's start off with this moment that we're in now in South Africa. We are now heading towards the peak, and the peak, it looks like, will be much worse than what we saw in many countries. Let's look at the UK.
Good morning, Michelle. Well, I think you're right that South Africa is now heading towards the peak, a peak which was always expected and was always forecast by your own modelers. Professor Karim, I remember, back in April and May, was forecasting a peak in July, August, and that is what has arrived. That was always something which was unavoidable. But as you say, what is good so far, what has been positive, is that the rate of those who have lost their lives to coronavirus in South Africa is so far appears to be considerably lower than in the Northern Hemisphere, including in my own country. And I think that is partly because South Africa has learned from the experience of countries like my own, in particular in the treatment of coronavirus. Some of the techniques which we've learned work. Some of the drugs which has some impact on patients' survival chances and recovery have been adopted here. And so I think that may be, I hope, partly why you're seeing the rate of those losing their lives lower here than in the UK and elsewhere.
Yeah, absolutely, Nigel. And those measures that you talk about, that perhaps we've learned from from countries like the UK, things like locking down the country really early, making masks mandatory in public spaces. If you look back at your own country's handling of those kinds of issues that we are now grappling with, how perhaps could the UK have done things differently?
Well, look, hindsight's a wonderful thing.
Yeah.
South Africa has had the benefit of this disease coming to South Africa later, and so we've been very happy to share the painful experience that we've gone through, and other countries in Europe and around the world likewise. I think it's not just around the sort of public health measures that you mentioned, but around the treatment by medical professionals. So hospitals, for example, learned in the UK that proning patients, laying them on their fronts, was an effective way of helping them breathe. They learned that actually oxygenation was as important, perhaps more important than mechanical ventilation. Some of these techniques, which have been learned painfully through trial and error in our own NHS, are now being used in South Africa's hospitals. There's an active dialogue. There's a thick human relationship between the two health services, and I hope that is now playing out to the benefit of patients in South Africa who suffer from this disease.
Yeah, absolutely. Nigel, as we turn our attention to the relationship between your country and South Africa, and the very real way that the UK has invested in helping South Africa overcome or at least mitigate the effects of the COVID-19 pandemic, just take us through some of those programs.
Well, we've got a very broad relationship with South Africa, and the support that we've looked to extend to South Africa in response to coronavirus reflects that. So we've tried to help in every way we can, right from the macro level, whether that is supporting South Africa's advocacy of suspension of debt payments for the poorest countries, support for the African Union's efforts, support for South Africa's own applications for special funding from the international finance institutions, all the way through that, through the health services response here, to right down to micro level. You mentioned a few of the things we're doing to help small businesses, to make sure that support is given to organisations who are combating gender-based violence, which unfortunately has been one of the areas of crime which has seen a rise during this epidemic. and helping manufacture PPE and helping with collaborations like the one between Donnell and Cambridge University to produce ventilators from open source material. So the full breadth of our relationship has been brought to bear in trying to contribute to South Africa's response.
Yeah, and of course the buzzword at the moment is vaccine. You know, every morning, if you're tracking the story like we are as journalists, that is what you look at when you look at your phone, that's the research that you're opening up first to see what is the latest on the drive, on the research for the vaccine. And the UK is also playing a really big part in that kind of global collaboration that we are seeing with many countries around the world.
Yeah, this is really exciting. I mean, the way out of this crisis ultimately is either going to be an effective vaccine that we can get around the world as quickly as possible, or effective treatments. And the progress that's being made in the trials that are being led by Oxford University in particular, collaborating with WITS here in Johannesburg, is really, really encouraging and exciting. Now, these are the first, second stage trials. Then they're not the end of the story. So people are excited about the possibilities that they offer. But we obviously need to wait and see. Vaccine development is an extremely difficult and uncertain business, as we know from the experience of trying to find a vaccine for HIV. But the resource that's going into the development of vaccines internationally is unprecedented, and there's an unprecedented commitment to making sure that those vaccines are available to all countries, not just the rich ones. Yeah. And the reason for that is simple. We know we won't get rid of this virus until we're able to eradicate it everywhere in the world.
Absolutely. Nigel, before we let you go, we've now reached 6,093 deaths, at least. Those are the recorded cases for COVID-19 deaths in South Africa. And it's a painful process to come to terms with the scale of the loss of life brought on by this virus here at home, around the world, for your country as well. With the people that you are talking to in your country, no doubt, what are you hearing about how people are recovering from the psychological impact of COVID-19, from this massive loss of life of family members, and from having to lay them to rest in such a removed way that was necessitated by the virus?
I think, to be honest, it's too early to really make an assessment of the psychological impact of this virus. And the impact is not just on those who've lost loved ones in tragic circumstances and perhaps been unable to say goodbye to them in the way they would have wanted. But we've got a whole generation of school kids, including my own and perhaps yours, who have been out of school for, in the UK now, an entire school term. They're hoping to get back in September, and society's been separated from itself in ways which are unprecedented. And so I think there will be a cost to that, and our hope is to get back to normal as quickly as is possible when it is safe to do that.
Yeah, absolutely. What will no doubt be a new normal for all of us. Nigel Casey, thanks very much for your time this morning on the AM Report. Nigel Casey is the British High Commissioner to South Africa, joining us there from Pretoria.